Today, our group will be discussing insecure attachment and its effect on romantic relationships. Bowlby's attachment theory stipulates that during infancy, humans develop close relationships with their primary caregivers via attachment behaviours, and that these attachments form internal models of relationships that are used throughout life. The strength and security of these relationships is based upon the consistency and level of attention provided by the caregiver. When attachment figures respond consistently and calmly, children tend to explore comfortably, seek proximity, and show less signs of stress. Alternatively, when caregivers are inconsistent, inattentive, or abusive, children are far more likely to develop an insecure attachment. This manifests in either anxious or avoidant. When an infant develops an anxious attachment, they often experience anxiety when separated from their primary caregiver. Conversely, infants with an avoidant attachment orientation tend to avoid or resist having contact with their primary caregivers. Insecure attachment creates maladaptive internal working models of relationships that can have detrimental effects on social functioning later in life. Research suggests that adult romantic relationships are shaped by similar internal models built upon the ones created in infancy. In adults, this can be modeled using two continuous variables: attachment anxiety and attachment avoidance. Secure attachment is associated with emotional regulation and coping. These characteristics support healthy romantic relationships. Alternatively, insecure attachment has been linked to destructive behaviours during discussions and support interactions. It appears that the continual emotional discomfort associated with attachment avoidance and the pervasive worry associated with attachment anxiety shape experiences in romantic relationships, encouraging maladaptive coping strategies. This has been found to create lower satisfaction and declines in relationship quality over time. The specific effect of insecure attachment styles on romantic relationships can be understood with reference to attachment system activation model. This model suggests that the internal models of relationships shape the behaviors exhibited in response to triggering events such as disagreements. These triggers induce affective and behavioral responses. Individuals with a secure attachment orientation respond to these events with healthy relationship maintenance behaviors, such as caregiving and pro-social activities to re-establish the positive bond with their partner. Alternatively, individuals with attachment anxiety respond with excessive proximity seeking and rumination. Further, those with attachment avoidance respond by suppressing their emotions and distancing themselves from their partner. These maladaptive responses can result in repeated attachment system activation, which can result in an increased sensitivity to these events. In turn, this can lead to individuals viewing ambiguous situations as triggers, thus responding unnecessarily, putting more stress on the relationship.
British psychologist John Bowlby developed an attachment theory that understands the anxiety and distress a child experiences when they are separated from their primary caregivers. Over the course of time, behavioural theories have suggested that attachment was the mere result of the feeding relationship between the carer and the child. As the caregiver feeds the child, it provides nourishment, and the child will therefore become attached. Bowlby analysed that attachment was characterised by behavioural and motivational patterns. For example, when a child is frightened, they look for their primary caregiver to receive comfort. Upon this, Bowlby believed that, quote, the propensity to make strong emotional bonds to particular individuals is a basic component of human nature, unquote. He categorised 4 different types of characteristics that aid attachment. One being proximity maintenance, which relates to the desire to be near people we are attached to. 2, safe haven, which highlights the need for the child to returning to safety when in fear of a threat. 3, secure base. This characteristic recognises that the primary caregiver acts as a base of security for their child. And 4, separation distress, which suggests anxiety exists in the absence of the caregiver. Bowlby, in relation to his attachment theory, proposes the relationship between the child and the caregiver. That is, the child develops expectations that their caregivers will be responsive to their needs at different stages of their life. Psychologist Mary Ainsworth proposed a strange situation which revealed the philosophical effects of attachment on behaviour. This study involved observing children between the ages of 12 to 18 months, where they would respond to a situation the situation being where they were left alone and they then reunited with their mother, being the primary caregiver. The sample size consisted of 100 middle-class American families. Ainsworth's strange situation followed a basic sequence. The parent and child are left alone in the room. The child explores the room with parental supervision. A stranger joins the room with the mother and the infant. The mother leaves the room. The mother then returns and the stranger leaves. The mother leaves and then the baby is left alone. The stranger returns and finally the mother returns and the stranger leaves the room. The study used observers who every 15 seconds ranked out of 7 the behavioural intensity signs the child was showing. The interaction behaviours that were ranked were based primarily on the 2 reunion interactions between the mother and the child, such as proximity and contact seeking. As mentioned by our previous talker, 3 main attachment styles were observed by Ainsworth: ambivalent attachment, secure attachment, and avoidant attachment. Secure attachment recognises that a child seeks comfort from parents when they are afraid. This results in similar behaviour as an adult, where they have trusting relationships and tend to share their feelings and emotions with their intimate partners. Ambivalent attachment tends to show that children display signs of distress when they are separated from their caregiver. Later in life, however, the subject can be left distraught when a relationship ends as they struggle to accept rejection. Thirdly, Ainsworth discovered, as a result of the test conducted, that avoidant attachment was the result of the child avoiding their caregivers. As a result of this avoidance, adults will tend to invest little emotion into romantic relationships and struggle to share their feelings with their partner. Further to this idea, adults with avoidant attachment tend to engage in casual sex as they lack the capacity to connect emotionally. A 4th attachment style, disorganized insecure attachment, was added by researchers Main and Solomon, which highlights that there is a lack of clear attachment behaviour. Ainsworth concluded her study by suggesting the maternal sensitivity hypothesis, which argues that a child's attachment style is dependent on the behaviour the mother portrays towards them. For example, avoidant infants are associated with unresponsive primary caregivers. That is, the child believes that communication has no influence on their caregiver. Therefore, Ainsworth's findings provided the empirical evidence of Bowlby's attachment theories. For example, avoidant children think themselves unworthy and unacceptable, caused by rejecting primary caregiver. As of this, insecure attachment styles are associated with an increased risk of social and emotional behavioural problems.
Insecure attachment can have a direct impact on the development of an individual and impact them in their everyday life. This manifests itself in many ways. There are strong links between the relationship of an individual having insecure attachment and also having poor quality of sleep, problematic internet use, perfectionist self-presentation facets, social disconnection, and depression. All these symptoms correspond with a decreased quality of life for the individual with the insecure attachment. However, insecure attachment not only affects the individual, but it also affects the way they relate to the people closest to them. A major impact of insecure attachment is the individual's inability to respond to conflict in a healthy manner. Situations of disagreement are when most implications become apparent. Evidence suggests that those who are affected by an insecure attachment style tend to develop increased aggression within relationships. The studies results that there was also a presence of jealousy and absence of trust in couples who displayed reciprocal aggression towards one another. This acts as a further detriment to developing healthy, secure relationships. An additional study reinforces the notion that insecurely attached individuals struggle to form trusting relationships with those around them. This was examined through the participants' involvement in electronic intrusion. The study indicates that there was an increased rate of electronic intrusion in college students who had this type of attachment style, with no differing levels between genders. It was suggested that this may be to assist with their anxiety relief. Insecure attachment style is also consistent with risk-taking behaviours. Alongside this, the study's results also specify that couples who are insecurely attached have an increased avoidance rate of the discerned risk-taking behaviour of their partner, once again avoiding conflict and damaging their ability to maintain long-term healthy relationships. John Bowlby, the first person to develop the attachment theory, describes it as the lasting psychological connectedness between human beings. Bowlby recognised that there was a correlation between issues with attachment and oppositional defiant disorder, conduct disorder, and post-traumatic stress disorder. His research also found that securely attached individuals had more positive relationships with those around them. This was measured through higher self-esteem levels, strength of romantic relationships, and the ability to be intimate with others through self-disclosure.
As found in Bowlby's study, insecure attachment styles elicit extreme lifelong effects on an individual's life, particularly in the formation and development of relationships and in any situation where attachment attitudes are present. The absence of a secure attachment to a significant other causes detrimental consequences on the way in which individuals cope in anxiety-heightening situations and in personal interactions. Various therapeutic strategies and interventions are used to improve attachment issues, particularly those who struggle to form romantic relationships with others. Based on empirical research and evidence, acceptance and commitment therapy, also known as ACT, has been used as an intervention for individuals with insecure attachment styles and attitudes. ACT is a behaviour and mindful-based intervention that is grounded in the acceptance of one's emotions and circumstances out of their control, and their commitment to taking action toward and focusing on what is fundamentally more important in their life. As a common symptom of psychological distress, experiential avoidance is the tendency for an individual to suppress and internalize negative emotions, thoughts, and feelings, rather than embrace them. This is extremely common in individuals with insecure attachment, particularly avoidant attachment, as they are more likely to suppress negative thoughts and feelings regarding problems that may arise in their relationship, rather than address it. The framework for ACT involves client-therapist-based sessions consisting of acceptance and mindful interventions alongside commitment and behaviour change strategies to enhance psychological flexibility. The fundamental techniques of ACT focus on normalising the individual's emotions, feelings, and internal experiences and embracing them as they arise. By accepting that these emotions are present and are a fundamental part of life, the individual will be able to possess a more meaningful and enriched perspective on aspects of their lives that they may find difficult and problematic, such as forming and maintaining deep connections with others. A typical ACT therapy session involves 6 steps. The consequences of suppressing and internalizing negative emotions are discussed. Psychological skills are established in order to accept these emotions and engage with them. A secure sense of self is established, which will result in the client no longer being threatened by their psychological distress. The client is encouraged to focus on the present moment. The client's fundamental values and life goals are clarified. And finally, the plans of action are devised for the client in order for them to focus on what's most important in their life. Using ACT techniques, the affected individual is taught coping mechanisms to embrace these emotions that come in hand with romantic relationships and attachment to a significant other. A recent study found that ACT assisted in the reduction of insecure attachment styles, particularly avoidant and anxious. In relation to Bowlby's study, ACT is an appropriate intervention for insecurely attached individuals, as these techniques will assist them to accept and normalise the negative emotions that may arise in their relationships and address them rather than suppress them. This will ultimately lead to the increase of positive emotions and optimising the development of healthy relationships with others. Successful treatment will result in the client upholding an enriched perspective on relationships, thus allowing them to form deep connections with others and minimise their psychological distress.
Emotionally focused therapy, or greater known as EFT, is fundamentally based on the adult theory of attachment. So the primary emotional bond that is formed between adult romantic partners is a large function of the attachment behavioural system that gives to the emotional bond between infants and their caregivers. So emotionally focused therapy surrounds its work on clients who are suffering relational turbulence in which couples are finding it challenging to preserve a sense of security and emotional safety within the relationship and or each other or themselves. So the therapy does two things. It looks within how partners construct their emotional involvement of relatedness, and the therapy looks between at how partners engage with each other and seeks to determine any current repetitive cycles or pattern. So why does EFT help with insecure attachment, or how more so? So it creates change by focusing on reprocessing and expanding the client's emotional responses. It strives to create new kind of interactions between partners. It helps to achieve secure bonding between partners and within that person as well. So there is some key interventions that are associated with EFT researched. So there's evocative responding, heightening, reflecting and validating. I'm going to touch on a couple of points for each. So evocative responding, it focuses on tentative, unclear or emerging experience, which the therapist will ask questions in relation to a client's present experience and their internal responses and reactions to the in-therapy dynamics. So heightening, the therapist will emphasize the specific responses or interactions in order to increase the client's emotional experience. And reflecting and validating is the therapist reinforces that each partner is entitled to his or her emotional responses and past and present experiences. So EFT works in stages. So I'm going to touch on a couple of the stages, and we're going to just touch on a couple of points in regarding to each. So stage 1, which is cycle de-escalation. So it involves helping partners identify the problematic interaction patterns as a root cause of relational turbulence. Restructuring is the couple's interactions to achieve a secure attachment bond. And consolidation and integration of therapeutic gains is the therapist redirects the client's attention to long-standing conflicts or issues. Some strengths of EFT, it emphasizes on the unconditional positive regard for the clients. So it's a sole focus is constructs as a tool of change regarding the extrapolation on the emotional, behavioral and psychological impact on partners that they obtain with each other. So I'm going to explain how the intervention would help with the individuals in relation to the case study. So emotionally focused therapy would help partners in therapy who are experiencing relational turbulence due to insecure attachment theory. So lasting psychological connectedness between human beings in relation to the case study. Because of these techniques that emotionally focused therapy entails, the interventions that are present are chosen in the chosen therapy will enable clients to be open and find a point of connectedness with each other as intervention aids to support couples in replacing attachment bonds. So EFT views couples as a system in which it acknowledges that one person does or says direct impact on what the other one feels. This is known as circular causality. So EFT is empirically supported treatment for relational turbulence as the therapy holds an experimental and humanistic approach due to early influences. This is clearly evident in practitioners' ability to be open, empathetic, and connective to their client's suffering, in which they communicate with direct and supportive understanding. So the therapy that we've chosen, so based on the research conducted, emotionally focused therapy is an effective intervention for an individual or clients or partners who suffer relational turbulence due to an insecure attachment bond with their partner. Although other therapies such as ACT can also be effective, we have found that the structural stages of EFT hold an integral part in therapizing this issue in relationships, thus making it a more appropriate and superior intervention than others.